Do some hand hygiene here. How are you today? Good. So I have a doctor's order here that we are supposed to start an IV on you and get you some fluids. Have you ever had an IV before? Okay, good. So you kind of know what to expect. It's just going to be a little small poke in your arm and it shouldn't hurt too much afterwards. Can I get your name and date of birth? Then I would check the wristband to make sure I have the right patient. And it matches up. So in the hall I checked the right dose, right route, right medication, right patient, right time, and then afterwards I will document all of this. First off, I'm going to spike the bag and get that all set up. So if you just want to go ahead and relax here, let me get my stuff kind of set up, and then we will go ahead and get started. All right, so I do hand hygiene again. Going to make sure I have the right medication. This does have the patient name, the medication, and then my initials on it. Initials, right, medication. I'm going to clamp this off first. I have this appropriate working height too. So I'm going to make sure after I pull this off, I do not touch anything. And I'm going to spike the bag. I'm going to hang it up here. Get it about halfway full. And then go ahead. Goodness. Prime the tubing here. Make sure we don't have any air bubbles in it. So I'm going to hang that up and do some hand hygiene. All right, so I'm just going to take a look here, see how these veins look. And I will forewarn you before I poke. All right, so I find a vein, make sure it palpates very well. Looks like it's a good vein. If there was any extra hair, I would shave it. Make sure it looks good. I'm gonna undo the tourniquet here, and I'm gonna get all of my supplies set up. I already put the blue pad underneath the patient's arm. They're sitting up in bed in a comfortable position for them and for me. Make it easier on both of us. So I'm gonna open up my start kit. Get my IV. Up this flush. Make sure I prime that. There's still a cap on there, so it stays sterile until I am ready to put it in. All right, so hand hygiene. I'm gonna put my new gloves on here. All right, here we go. I'm just going to clean your skin here first, and I will let you know before we poke, okay? So we're gonna try this again. Clean the site. The site is clean. All right, big poke here. There we go. Not too bad, huh? Let's take that off. Ideally, they would not be leaking everywhere. Hook this in. And flushes beautifully. So, take my dressing cover here. Make sure that you can see the end of the catheter. So if you have any burning sensations, if your IV starts to hurt you real bad or anything like that, please let me know right away. Gets red, swollen, you know, any of that. So I'd put the date and my initials of who put the IV in. Then so there's that, and clamp this off. Then I would also mark the tubing here of the date and time of who administered, or the date and time of when the tubing was started. All right, and then I will clean up my mess. Sharps container. I will lower the patient into a comfortable position, safe position, and I will go document everything that I did. After everything is put in, I figured out that we need to set the drip rate to 28 drips per minute. I made sure that the patient knows that not to try and like put pressure on it, bend it, any of that. And then we have the right medication going. I will come in every hour and make sure that that infusion is still going okay and the drip rate is correct. And then make sure the patient doesn't need anything. All right, so I forgot on the last one that we need to actually hook this IV up. So I would clean this port, let it dry. And put it in there. It's connected. And then this is when I would calculate the 28 drops per minute. Let the patient know if it's burning, if anything else happens, to let us know. drip right there.